Welcome to the deep dive. We're here to plunge into some fascinating advancements, really break down complex stuff into something clear and useful for you. Today, we're looking at quite a big shift in medical treatment. It's a great example of how precision, like a gentler touch, is changing patient care, even for conditions that, for a long time, relied on pretty aggressive methods, honestly. We're zeroing in on Dupuytren's contracture that's a condition affecting the hand, and, well, the real challenge is tied up with its usual enzyme treatments. Okay, let's unpack this a bit. We're about to deep dive into a really novel approach, the Gentle Collagenase Injection Protocol, GCIP for short. And the idea is that it's a safer, much more controlled way to treat Dupuytren's contracture, moving away from maybe a brute force kind of method. Leading this work, it's two really impressive people in the field. There's Dr. Lev Nemotin, he's a CEO of N5 Digital, Inc., heading up their R&D, and Dr. Samantha Mulrad, who is Chief of Hand Surgery and directs the Hand Surgery Fellowship at the Renaissance School of Medicine's Department of Orthopedics. So, real experts pushing the boundaries here.
Yeah, and it's crucial to understand what they're trying to improve on. The standard way of treating Dupuytren's with enzymes, it usually involves injecting a pretty high dose of this enzyme, collagenase Clostridium histolyticum, right into the fibrous cord in the hand. And then, immediately after, there's this forceful manual extension. They basically bend the finger back hard to try and rupture that cord. Now, it can work to break the contracture, but honestly, the standard way has a really high risk of complications.
Complications like what specifically?
Well, things like skin tears. Those can be quite painful, slow to heal. There's also potential injury to tendons, nerve damage, which could mean losing feeling or movement in the fingers.
Wow.
Yeah, and even the enzyme itself spreading out where you don't want it, potentially damaging healthy tissue nearby. It's not ideal.
Right. So, okay, knowing those risks are out there, our mission for this deep dive is really to explore how this new GCIP, this gentle protocol, tries to tackle those head-on, offer something more precise, and hopefully lead to much better outcomes for patients. Maybe even set a standard for other areas, too.
Exactly. Precision over just force.
So let's really zoom in. What did Drs. Nemotin and Mulrad identify as the core problems in their background work?
They seem pretty clear that while, manually rupturing the cord works to reduce the bend, it also brings in preventable trauma. And this isn't just guessing, right? There's data.
Oh, yeah, absolutely. Clinical trial data.
It showed skin tearing rates as high as, 20 to 30%.
That's right. Think about that. Maybe 1 in 3 patients getting a skin tear.
That's huge.
It is. And it's not just the skin. There are other risks, too, like damage to the flexor tendons, problems with the digital nerves.
The nerves that control feeling and movement. Exactly those. Plus significant inflammation. And they really point out that these bad outcomes often happen because of errors in targeting the injection depth. Or, and this is key, because active enzyme gets released sort of uncontrollably when the cord is ruptured.
It almost sounds like the treatment itself could be pretty traumatic.
You've kind of hit on the main issue there. The enzyme itself is good at breaking down the collagen. That's not the problem. The problem is how it's activated, or rather how the cord is broken after the enzyme is in there. That forced extension, it's meant to be a controlled break, but it's often, a bit blunt.
Like using a hammer for fine china.
Sort of, yeah. You're aiming for a specific break in the cord, but the force, and then the enzyme spreading out because of that force, can easily damage the delicate stuff around it. The skin, tendons, nerves you want to protect. And that's what leads to those complications we mentioned. The traditional way just prioritizes getting it straight now, with force, over a potentially gentler, more controlled chemical process.
Okay, so with those significant downsides really clear, it makes you wonder, what was the absolute top priority for Drs. Nemotin and Mulrad when they designed this GCIP? Were they thinking like a total rethink or just tweaking the old way? What specific goals did they set out to achieve?
Oh, it was definitely more of a rethink, a paradigm shift, really.
Yeah.
The goals for the GCIP approach are laid out very clearly to directly counter those risks of the old method. First and foremost, the big one, completely eliminate or at least massively reduce that post-injection trauma. That's huge.
Right. No more forceful rupture.
Exactly. Second, prevent the enzyme from going off target. Keep it working just inside that fibrotic cord, protecting the healthy tissue around it. Third, and this is really important, make the treatment adaptable. Tailor it to the patient's specific anatomy, how severe their cord is. But the Dupuytren's isn't the same for everyone.
Makes sense.
And finally, a very practical goal. Make it repeatable, low risk, and doable in different places, not just specialized centers, making it more accessible.
Okay, so problem defined. Goals set, very patient-focused goals too. Now, the really interesting part How did they actually design a gentle way to do this? How does this new protocol work, step by step to actually achieve all that?
It's really quite elegant, focused on precision. The Gentle Collagenase Injection Protocol, GCIP, it's a careful multi-step process. So it starts with step 1, imaging and injection planning. This is a big change. Instead of just feeling the cord, they mandate using imaging. Usually ultrasound, which gives you those real-time pictures of soft tissue, or if it's available, maybe even OCT, optical coherence tomography, that gives incredibly high-res, almost microscopic cross-sections.
Like a map, basically.
Exactly like a map. You find the cord, see exactly how deep it is, how thick, and crucially, where it is relative to tendons and nerves. It's like planning a delicate operation beforehand. Then, based on that map, they divide the cord into, say, 2 to 5 different injection zones, depending on how long or tight it is.
Okay, so mapping first. What's next?
Step 2, multi-point microinjection. This is also quite different. Instead of one big shot, they use much smaller amounts of the enzyme per injection site, tiny amounts, like 0.05 to zero point 0.1 milliliters.
But the total dose is the same.
Yes, that's key. The total amount of enzyme the patient gets is the same as the standard protocols. It's just distributed much more finely. Think of it like watering a plant evenly with a sprinkler instead of dumping a whole bucket in one spot.
Got it.
They inject right into the center of each zone they mapped out, ideally using ultrasound to guide the needle for pinpoint accuracy. This microdistribution stops large pools of enzyme forming, which reduces that risk of it spreading and causing damage.
That makes a lot of sense, spreading it out thin. So, okay, the enzyme is in there, carefully placed. What happens then if there's no big rupture maneuver?
This leads to step 3, the enzymatic soaking period.
Right.
And this is probably the biggest shift from the old way. There's absolutely no attempt to rupture the cord for 48 to 72 hours, 2 to 3 days.
Wow. Okay, so what does the patient do?
They're actually encouraged to just gently move their hand, as long as it's pain-free, nothing forceful. The idea here is that this gentle motion, plus the waiting time, lets the enzyme spread thoroughly within the cord itself. It gives the enzyme time to work, to naturally break down the collagen more completely, without needing that sudden traumatic force. It's letting chemistry do the work gently.
I can really see how that changes things for the patient, avoiding that, really intense, painful moment. So after this soaking time, how do they actually get the finger straight?
Right, that brings us to step 4, gentle stretching and splinting. Around day 3 to day 5, once that enzyme has done its work, they start either dynamic extension splinting.
What's that exactly?
It's a special splint that applies a constant but very gentle stretching force to gradually straighten the finger over time. Or they might use guided physical therapy. The whole point is gradual elongation of the soft tissue. The cord is already weakened by the enzyme, so now it's gently coaxed into extension over days or weeks. No abrupt trauma at all. It's about patiently stretching, not forcing.
Much less risk of tearing things that way, I imagine.
Exactly. And there's one more step. Step 5, re-injection if needed. The protocol acknowledges that, hey, sometimes one round isn't enough, or maybe one part of the cord is tougher than another. So if there's still some contracture left after the first cycle, those specific areas can be treated again with repeat low-dose injections following the same gentle process.
So it's adaptable. You can fine-tune it.
Precisely. Adaptive correction, always keeping safety first.
Okay, so when you put all those steps together, imaging, microinjections, soaking, gentle stretching, maybe a repeat, what does this really mean for the patient? What are the big clinical advantages? It sounds like a potential game changer.
The advantages seem pretty significant, yeah. First off, it's low trauma and high precision. That's the headline. Minimizing damage to healthy tissue is a huge step forward. And it seems applicable across the board, mild cases, severe cases, makes it versatile.
And the specific risks we talked about earlier, skin tears, tendon issues.
That's where it really shines. The risk of skin tears and tendon rupture should be drastically reduced. That makes the GCIP much, much safer. Think about patients who are more vulnerable, older people with thin skin, people with diabetes, or other conditions that affect healing. For them, avoiding those complications is critical.
Yeah, that's a huge relief for those groups.
Definitely. Plus, looking ahead, because it's so precise and controlled, it seems really well suited for integration with things like robotics or even more advanced imaging in the future.
Right, paving the way for even more tech integration. Now, beyond just being generally better, who specifically would benefit most? Are there particular proposed use cases where GCIP would be the obvious choice?
Yeah, the authors highlight a few groups where this could be particularly impactful. Elderly patients, definitely. Their skin is often thin, fragile, prone to tearing and bruising with the old method. This gentle approach is ideal.
Makes sense?
Also, cases where the contracture has come back after previous treatment or after surgery, the anatomy might be tricky, maybe there's scar tissue. The precision of GCIP helps navigate that. Okay.
In patients who have really deep cords, or ones that spiral around nerves or tendons complex cases, the imaging and targeted microinjections are perfect for minimizing collateral damage there.
Yeah.
And then, of course, any patient, or doctor for that matter, who simply wants to avoid that mechanical rupture part, maybe for personal preference, maybe because of other health risks, GCIP offers that alternative.
So it really covers a range of needs. Now, connecting this to the bigger picture, this sounds great, but how does it get proven and rolled out? What's the plan for validation?
Right, good question. It's not just theory. They've outlined a clear pilot study design. The plan is a randomized clinical trial. That's the gold standard. They'll directly compare GCIP against the standard rupture protocol head-to-head.
And what will they measure?
Key things.
Yeah.
Complication rates, they expect those to be much lower for GCIP. How much the range of motion improves in the hand, objectively measured. And really importantly, patient-reported outcomes. Asking patients about their experience, their satisfaction, how well their hand functions afterwards, that gives you the real-world picture. Yet the patient perspective is crucial. Where will these studies happen?
They're planning to run them in different settings to make sure the results are broadly applicable. So academic hospitals, yes, but also typical outpatient clinics and hand therapy centers. Getting data from all these places will build a really strong case if the results are positive, paving the way for wider adoption. So really, the bottom line from their work is this. GCIP looks like a scalable, much lower risk alternative to the old way of doing enzymatic treatment for Dupuytren's. It fits perfectly with where medicine is going towards more precise, patient-specific care. And like we said, it seems ready for future tech, like robotics.
It really makes you think, doesn't it? This shift from what you call brute force to gentle precision. How could that ripple out? Think about other areas of medicine where maybe we rely on somewhat aggressive methods. Could this kind of thinking, especially with tech like robotics and imaging getting better all the time, transform those treatments too? What does this deep dive suggest to you listening in about the future, not just for hands, but maybe for other conditions needing more targeted, less invasive touch? It's definitely a powerful idea that sometimes the most careful, gentle approach actually leads to the best and safest results. As always, we hope this deep dive sparked some thoughts and gave you a glimpse into where medical innovation is heading.